Anxiety is a feeling of dread or fear in the absence of an external threat or where the feeling is disproportionate to the actual nature of the threat. There are some predisposing conditions that could precipitate an anxiety attack: prolonged unmet needs of dependency, unmet needs of security, love, and attention; stress, where you have unacceptable thoughts or feelings surfacing to consciousness, for example, rage, flashbacks. You could have various forms of or levels of anxiety. It could be mild, where there's a high degree of alertness with mild uneasiness. It could progress to a moderate level. Here you see the heart is pounding, the skin is cold and clammy, you have poor comprehension. It could progress further to a severe level where you have symptoms of the same heart pounding, skin cold, clammy, poor comprehension, in addition to hallucinations and delusions. And finally, you could have a panic level with symptoms of severe anxiety, plus the client being unable to see or hear, unable to function, and may actually regress to less appropriate behaviors. In terms of assessment of a patient who is anxious, you're going to see increased pulse, blood pressure, and respiration. There could be palpitation. There could be perspiration, flushing. You will notice the hands are cold, the feet are cold. On the GIT system, there could be nausea and vomiting with diarrhea. In the musculoskeletal system, there's tremors, there's jerking of limbs, there's increased fatigue, there's increased muscle tension and tendon reflexes. The client usually, like we said, has poor comprehension, poor concentration, impaired problem-solving ability. There's feelings of helplessness and hopelessness. He has that immense feeling of increased threat. There's this dread, horror, anger, and he begins to use defense mechanisms and adapt more primitive coping behaviors. So what are the general principles for intervening if you have a patient who is anxious? First, you want to start with assessments, assess level of anxiety. You want to use standardized tools to ensure consistency. Look at the body language, look at the speech pattern, look at his facial expression. What mechanism, defense mechanisms are in use? Again, you want to keep environmental stresses and stimulation low, especially when anxiety is high. So brief orientation to the unit or procedure when you are interacting with this client. You can give him written information to read later when anxiety is lower. You want to keep him in a pleasant, attractive, uncluttered environment. Again, if the presence of other clients are overstimulating your client, you can provide privacy. Avoid offering several alternatives or decisions when anxiety is high. Another general principle would be to assist the client to cope with anxiety more effectively. You want to acknowledge anxious behavior and always remain with a client who is moderately or severely anxious. Assist client to clarify his own thoughts and feelings. Encourage measures to reduce anxiety, such as exercise, activities, talking with friends, engaging in hobbies. Again, provide therapy to develop more effective coping and interpersonal skills. And you may need to administer anti-anxiety medications. Also, maintain accepting and helpful attitude toward your client. Don't be in a hurry, use an unhurried approach. Always acknowledge the client's distress and concerns about his problem. Evaluate and manage your own anxiety while working with the client. Again, recognize the value of defense mechanism and realize that the client is attempting to make the anxiety tolerable in the best way possible. So that's a way of coping. And again, acknowledge defense, but provide reality. For example, you do not see that you have a problem with alcohol, but your blood level is high. Okay, so you want to acknowledge the defense which the client is putting up, but also provide reality. And do not attempt to remove a defense mechanism at any time. So what anxiety disorders are there? We could have phobia, which is one type of anxiety disorder. And when you see your patient, you're going to see him apprehensive, he's anxious, he feels helpless when confronted with that particular phobic situation or feared object. Some specific examples of fears could be acrophobia, when someone is scared of height, claustrophobia, when the person is scared of a closed space, agoraphobia, when the person is scared of open spaces. Your nursing interventions will include avoid confrontation with the specific fears. Do not focus on getting the client to stop being afraid. You want to gradually desensitize this patient from his fears, which is called systematic desensitization. You can adapt relaxation techniques, carry out general anxiety measures, and this client may be managed with antidepressants. With OCDs, which is our obsessive compulsive disorder, obsession will refer to repetitive, uncontrollable thoughts, which you will see in this client, and the compulsion would also be repetitive, uncontrollable acts, such as rituals. He may be engaging in rituals and repeating them on and on and on. There could be rigidity, there could be inflexibility. So again, you want to accept these ritualistic behaviors, structure the environment, and provide for physical needs of your clients. You want to offer alternative activities, especially the ones that would engage his hands. You want to guide his decisions and minimize choices. Encourage your client to socialize and engage in group therapy. These clients with OCDs might be managed with clomipramine or SSRIs. Again, we could have another type of anxiety disorder, which would be functional neurologic disorder. Here, there are physical symptoms with no organic basis. They're actually unconscious behaviors. You could see blindness, paralysis, convulsions without loss of consciousness, stocking and glove anesthesia. By this, we mean stocking, the areas where the stocks would cover, he would not feel any pain around there. The glove area on your hands, he would actually not have any feelings in that area. So that's what we refer to as stocking and glove anesthesia. And again, there could be labile indifference, where he's unconcerned about his symptoms. So you want to carry out some diagnostic evaluations and discuss feelings rather than the symptoms that this patient has. Promote therapeutic relationship with your clients. And again, avoid secondary gain.